When memory disorders are mentioned, most people will think of Alzheimer's disease. As most of you may know someone with Alzheimer's or have at least heard of it. My major is psychology and I read a lot about memory disorders. There are many other memory disorders other than Alzheimer's disease. For example, antegrade amnesia and frontotemporal dementia. Today I'll talk about those disorders, antegrade amnesia and frontotemporal dementia, how they develop, and how if they can be treated. Antegrade amnesia is the memory loss and inability to create and form new memories. As most of you know, Dory from Finding Nemo, she has a memory disorder and cannot create new memories as well. Sanjay Kumar from the journal Psychology and Clinical Neurosciences states that the cause is after tragic accidents or traumatizing events, even with no previous disorders of any kind. Kumar then explained a 38-year-old man with no history of brain damage was diagnosed with antegrade amnesia after a psychological trauma. No further detail was mentioned of what the trauma was, but he became restless and panicked and became unfamiliar with his family's faces and was sent to the hospital. Antegrade amnesia lasts for months or a lifetime with little or no improvement. After 9 months, the man had progressed very little in his memory, but did not fully recover. There is no treatment that can rid antegrade amnesia, but there are different methods that have been tested. Antegrade amnesia can be handled and be lived with. For example, 50-year-old Angie demonstrates. Melissa Duff explains in Journal of Clinical and Experimental Neuropsychology that Angie was diagnosed with antegrade amnesia after a motorcycle accident when she was 29 years old. After years of help from her family and friends, she was able to understand her disorders, finish college, and maintain daily tasks. But then there's 13-year-old CJ, whose antegrade amnesia was brought on by tumors. He went through radiotherapy and chemotherapy, but the antegrade amnesia had not been terminated. So he was the first child to do SenseCam. Caitlin Polytotics mentions in Memory Journal that the SenseCam is a camera worn around the neck presented so it helps restore memories and structure new ones. CJ and his family took walks every day for 2 weeks to the same place and recalled the pictures of the places that he's been to recall his memory. His short-term memory improved, but not his long-term memory. Antegrade amnesia is also as common as frontotemporal dementia. In the journal Return to Memory and Aging Center, frontotemporal dementia is explained as damage to the frontal and temporal region of the brain, which holds the personality and behavior of each individual. It is also described as incapability to act appropriately, how to learn, how to reason, and how to do daily tasks. The cause is not accurately known, but there's a theory that the brain cells of each individual is affected by protein changes, which affects the behavior and thinking. Francesca De Reno explains in Neurological Sciences Journal that frontotemporal dementia and Alzheimer's disease are often confused to be the same disorder. But Alzheimer's disease is often seen in people over the age of 60, whereas frontotemporal dementia is seen in people under the age of 60. Frontotemporal dementia also includes socializing and communication problems, both related to memory functions. But Alzheimer's focuses on social behavior functions only. Similar to antegrade amnesia, frontotemporal dementia has not been treated, but there are medicine that helps with the symptoms. It is important to be diagnosed with the correct disorder before taking any medicine. With the correct medicine, the dosage starts low and then is slowly raised based on the reaction. Individuals with frontotemporal dementia behave inappropriately, so antidepressants like selective serotonin reuptake inhibitors are often used to control those aggressions. Sandovalli Khandra describes in Indian Journal of Psychological Medicine, says that medicine helps with the symptoms further on in frontotemporal dementia, but it is urged to do yoga and meditation early on. Those are pushed for the early signs of frontotemporal dementia, and individuals are not in serious harm. The medicine will not help at that state, but meditation is pushed to help to clear the mind. Frontotemporal dementia and antegrade amnesia both damage damage the loss of memory and make tasks hard to do. Anagram amnesia makes it difficult to create new memories, whereas frontal-temporal dementia causes trouble remembering appropriate behaviors and responses. Anagram amnesia and frontal-temporal dementia are often different from Alzheimer's disease, but all are considered under the same category. Memory disorders are more common than people are aware of and are not fully treated.